In a hospital, materials need to be available at all times, and they need to be in the right place. The reason for this is that quite often, life is on the line. The hospital logistics team's mission is to make sure the right item will be in the right place at the right time, in good condition, in sufficient quantities, and at the best cost possible. That way, clinical staff can spend all of their energy and time on essential matters, providing patient care.
We have been working with hospital logistics since 2008. We have two fundamental goals. The first one is to generate substantial savings. The second one, which is as important as the first one, is to significantly add value to the clinical chain by decreasing as much as possible the health care provider's workload. We need quality and high-performance teams to reach these goals, and we are very proud of our teams.
The approach chosen by the CHUS takes inspiration from the most advanced countries in terms of hospital logistics, France and the United States. They use a warehouse management system called Copilot WMS. This system allows them to keep track of supplies and ensure tracking all along the logistics chain. It can track down an item at any given moment on the chain. Let's take our tubing and examine the path it followed from the supplier to the emergency room. This path is the logistics chain. Early in the morning, the stockkeeper goes to the patient care unit to take an inventory of supplies and materials. First, he reads the label upon entering the room. This label, which works just like an address, is used to identify the patient care unit, to bill the unit, and to collect usage statistics. The stockkeeper reviews all the material. He reads item labels for which the quantity is under the quota established by the care unit and enters the required amount needed. The data collected are all sent to the distribution center. The dispatcher receives the data and defines order preparation according to priority and emergencies. Afterwards, he sends the order to the optical readers of the clerk assigned to this task so that he can prepare them. We will come back to this step in a few minutes. The stock manager also accesses data. While the team is preparing the orders, she restocks the center according to demand. She is the one in charge of maintaining the right level of stocks for all the items in order to avoid any inventory shortages. In case of shortage, she takes part in identifying substitute products. She is also responsible for cyclical inventories. The items ordered start their voyage at the suppliers and end up in the distribution center. Upon arrival, a stockkeeper checks their condition, the quantity received, and the best before date. He enters the data into the system, prints a label, and sticks it on the item. This label indicates where the item should be stored. The item is then stored where the label says it should be stored. This system greatly reduces the number of errors. Now, back to the matter at hand. Let's go back to the logistics chain, at the moment when the dispatcher sends an order to a clerk. You understand that restocking the center and order preparation happen in parallel. The clerk takes the order and prepares it by following a predefined path to avoid any loss of time. He reads the label where the ordered item is stored. The system automatically validates the storage site and avoids any errors in the order. The clerk places the item in a box and reads the box label. This way, each item can be tracked. This ensures traceability. Boxes or packages going to a specific client are gathered on the same cart. Their barcodes are read so that they can be associated with the cart. The cart is then identified for shipping. Carts are loaded in trucks and delivered to a specific docking area. The CHUS has 5 delivery locations. The stockkeeper who collects data on required items in the morning gets the cart from the delivery location on the same day. He takes it to the patient care unit. Once in place, he reads the label on the cart, as well as the one on the door, to make sure he has the right delivery address. He stores the items on the shelf and makes sure to rotate items. Then, he makes sure that every item ordered has been delivered. The work is now done for this healthcare unit or for this client. As for our tubing, it will arrive at the proper destination at the right time after this long trip. At the CHUS, the logistics team similarly manages the daily inventory of about 2,000 medications sent to the pharmacy and care units. The system makes it possible to track a product at a location as precise as a fridge shelf. The stock keepers in the pharmacy's warehouse were all trained as pharmacy technical assistants. It is a first in the province of Quebec.
At the hospital pharmacy, we work closely with a logistics team to manage medication stocks. Since there are technical assistants who work at the medication warehouse, we have the ability to give them certain tasks, such as reading generic names and looking for outdated products directly in the patient care unit. Furthermore, their training allows them to react quickly in case we run out of stock. This collaboration allows pharmacists to spend more time on direct patient care.
The logistics team manages the supply of all types of products used in hospitals. In addition to medical supplies, this team takes care of the medical equipment, oxygen tanks, janitorial and sanitation products, hazardous products for laboratories, office supplies, and so much more. They also prepare kits for patients on hemodialysis, sparing medical staff this task. Each year, more than $100 million in stock pass through the distribution center. 2,200 products are kept in stock, and more than 20,000 coded products are processed. Built in 2008, it is the only regional distribution center located outside of hospitals in the province of Quebec. In addition to the CHU, it supplies products to 250 medical clinics and to the CSSS du Val-Saint-François.
4 challenges remain on our path to success. First, we must finish the training of the logistics team in order for them to understand their tools, that is the WMS software and the distribution center. Second, we should take advantage of our excellent location to offer our services to other facilities in the region. Third, we must polish our services for highly critical healthcare units, namely the angiography unit, just as we did for the laboratories. Lastly, we must improve traceability by including batch numbers, serial numbers, as well as manufacturing and best before dates. This should be done from the supplier all the way up to the patient's electronic medical record.
The CHUS Hospital Logistics Team is comprised of 30 people. They all share the same goal: making sure the right item will be in the right place at the right time, in good condition, in sufficient quantities, and at the best cost possible. This is their contribution to patient care.